Hi, you're listening to It Happened to Me, a rare disease and medical challenges podcast. The mission of our podcast is to support you, our listeners, and to create community as you confront the toughest challenges in life. All of us will experience health hardships. The real question is how we adapt. That's the focus of It Happened to Me, which wants to help you overcome limitations and live a full and satisfying life. Drawing on their own health challenges, co-hosts Kathy Gildenhorn and Beth Glassman interview guests who share stories and research to help you succeed in the face of difficult health obstacles. It happened to me. I'm not alone, and neither are you.
Today, we are going to discuss Bloom syndrome with our guests, Melanie and Lorne Yasbin, as they have two sons, one of whom has been diagnosed with Bloom syndrome. For over 20 years, Lorne has been practicing general dentistry in Frederick, Maryland. In addition to practicing chairside, Lorne is the clinical director for 14 offices in Maryland. Lorne is in his third year of serving on the board of the Bloom Syndrome Association, where he currently chairs the Community Engagement Committee. Melanie is also an active volunteer for the Bloom Syndrome Association. She's had a successful career in law. After working for the federal government for several years, Melanie joined a private practice where she represents railroads in negotiations with each other and before federal agencies.
Bloom syndrome is a rare genetic disorder characterized by very short stature, light sensitivity, immune system deficiency, and a high risk of developing cancer at a young age. Other features include chronic respiratory illness, recurrent ear infections, and diabetes. Males experience infertility, and women enter menopause at a very early age and experience reduced fertility. There are only a few hundred documented cases worldwide. Melanie and Lorne, we want to thank you for joining us today and being guests on our podcast. We appreciate your openness. Melanie and Lorne, what would you like to add to our explanation of Bloom syndrome?
The explanation is very accurate, with the caveat that there are so few individuals that have been diagnosed with Bloom syndrome that there are certain things that are maybe individual to some people and maybe part of the disease, but at this point with the research, we're not sure.
Now, Bloom syndrome, as I understand, is rare and disproportionately affects Ashkenazi Jews or people from Eastern European descent. Our listeners can refer to episode 7 for our interview with Karen Grinzade at JScreen, which is located at Emory University. JScreen offers genetic testing and counseling to anyone that has a focus on Ashkenazi and Sephardic Jews. Have you met with a genetic counselor? And if so, at what point was it helpful? What about the conversation?
We both did genetic screening when we first got married, but at the time, Bloom syndrome wasn't on the panel, the testing panel, but now it is. But we did meet. We never really met with a genetic counselor. We have I have a background in genetics, and so did my father, which is kind of how we came about learning about this in the first place. Wow. But we did meet with a genetic counselor. I think after he was diagnosed, right, Mel, at Cornell. But we never met with one, beforehand. But once he was diagnosed, we did meet with one. But we didn't really. We were pretty well equipped and knew most of the information and the data at that point.
So when did you notice that something was different with your son?
The day he was born.
Really?
Really? He came out. He was
3 weeks early.
Yeah, he was
3 weeks early.
Which we found from most other people, it's about when most individuals with Bloom kind of are born. They tend to be about 3 weeks early, unremarkable pregnancy. And then, in fact, Melanie, it was so unremarkable, she never had a sonogram or an ultrasound right after 19 weeks.
We did the anatomical sonogram, and then there was nothing concerning, and he was measuring maybe a week or two small, so there was no need to do additional sonograms. So he was born, he was 2 pounds, 15 ounces when he was born.
Oh my goodness.
Wow.
And he,
little.
Yeah, and he flew out. Like the doctors almost dropped him. There was no restriction, and we were like, what's going on here? So it was kind of our first kind of shock. But amazingly, he came home. What did he come home? 4 pounds? Under 4 pounds?
He came home at 3 pounds. He was in the NICU for 2 weeks.
Right.
The only reason they kept him in the NICU was because he was so small and he couldn't maintain his body temperature. As soon as he could maintain his body temperature, they said, there's nothing wrong with him. He's all yours.
Wow.
And was feeding difficult?
They're feeding with some Bloom syndrome children has been difficult. Brady has always been a very good eater. Even when he was little, the problem is he was so small, he couldn't eat that much. There wasn't enough room to store all of the food that he ate. So.
We used to have to track like ounce by ounce how much he would eat, and we would like celebrate when he'd have 2 ounces and 3 ounces. So we didn't know, right? So
because he was so little.
Because he was so little.
This was more because of his size, really not because of the condition.
Right. And this is something that can become so frustrating for a lot of parents of patients with individuals with Bloom, is they go to, feeding counselors and nutritional counselors, and right away they're told to feed them more or do this or try this or, try different protein additives. And then there's always, there's been accusations of abuse because the child's aren't thriving and they're not growing. But without at this point, there's no diagnosis, right? So no one knows why the child's so small. So everyone's making these random guesses. So that gets very frustrating for people.
Oh, what a terribly stressful time that must have been.
For sure.
Are doctors starting to know more about Bloom syndrome, that it exists? Are they aware of it so that particular approach to small children who do have Bloom syndrome isn't the norm?
Yeah, I'd love to say yes, but as it's so rare, it's still one of those things that unless you have a real savvy doctor who's like, there's something not right here, maybe we should take a look. And the good news is, in today's world with the internet, I mean, there's an app. There's actually an app that Bloom is on, where you take a face shot of the child, and it actually gives a certain facial characteristics of Bloom, right? And it can actually kind of trace those things and kind of give you a roadmap. But you have to be a savvy doctor to say, wait, there's something going on here. Let's look a little closer, rather than, it's just a feeding issue or failure to thrive issue, possibly an abuse issue. You have to really look think outside the box.
And that said,
I was going to ask you about the hallmark patch across the nose and cheek. Did Brady have that? So
interestingly enough, he did not until he was
did not.
At first, no, until he was about
5.
He was about 4 or 5 when he first had it, and that was one of the things that kind of led to where we are.
He was 4 or 5 years old.
Yeah,
not till he was 4 or 5 years old.
Right.
So we're talking about a redness across his cheek and nose.
It almost looked like a contact dermatitis. At first, we attributed it to him wearing like contact or his swim goggles. Is when we first noticed it, because his really wasn't sun induced. It was more like contact induced. And so that's the first time we kind of noticed it.
Wow.
And he doesn't have it now. Now he doesn't have it.
And it's been described as looking sort of like a butterfly for our listeners. With this redness patch across the face. Would you agree with that?
Yes, absolutely. It does look like a butterfly starting at the nose and winging out to the cheeks.
Now,
but he came later.
For Brady, yes. I mean, that's one of the things that led to his diagnosis. He wasn't diagnosed until he was 5.
That was my next question. I want to dive deeper into your diagnostic odyssey. And when was he first seen by a medical provider, as somebody who knew what to look for, and what was their specialty? How did you end up there?
You want me to take this one?
Well, I'll start. So we had a fabulous pediatrician, and Bloom syndrome is something that he had heard of and that he knew about, but he did not see because Brady was not chubby by any stretch of the imagination when he was born, but he had a full face, and he didn't necessarily, Lauren, wouldn't you agree? He didn't necessarily look like a typical Bloom syndrome. When he was
looking back
baby.
on things, yes, but as a baby, no. But really, what it came down to was, in our case, we because he wasn't growing, our plan was to put him on growth hormone as early as possible. So when we did that, we did meet with one endocrinologist who had some suspicions of some genetic, abnormalities. So we did meet with at that time with a geneticist whose cousin was a preeminent expert in this. What was it? Primordial dwarfism, like a specific kind of dwarfism.
Oh, wow.
So right away, so it's one of those when all you have is a hammer, everything looks like a nail. Like she thought for sure that he had primordial dwarfism, which when you go through the list, it was absolutely not. There's no way. So we kind of dismissed genetic disease at that point and said, look, let's try growth hormone and see what happens. And in Bloom syndromes, the mantra was it doesn't work. We didn't even know about Bloom syndrome at this point, but we put Brady on Bloom syndrome on growth hormone, and it worked. I mean, he started growing. He started going up to he's at the 20th percentile now. I mean, he's a tall bloomy, so to speak. But it started to work. So right away, once it started to work, we kind of put the genetic disease or genetic abnormality concept in the back window. Yeah, to the side. We didn't really ever think about it again.
Prior to starting growth hormone, which you started at 2. We saw the geneticist, we saw the gastroenterologist, the endocrinologist. He had various MRIs to determine. He had a brain MRI for, I don't remember why, but it was one of the things that we had to do in order for them to sign off on the growth hormone, and everything came back normal.
Well, ultimately, what testing was there? Genetic testing? Was it other type of testing? What ultimately confirmed the diagnosis of Bloom syndrome?
So I'll give you the story real quick. So like I said, my father is a retired molecular biologist, and very active in the Jewish community, very active in genetic testing. So when he was dean in Missouri, he had brought in a rabbi in a testing program to talk about, I think it may have actually been J-Screen, to talk about genetic testing. And they were going through different diseases, different things to look for, Tay-Sachs, right? All the big ones. And then Bloom syndrome was on the list. And there was one individual with Bloom named Cheryl Grossman, who's a big advocate for Bloom syndrome, who's from the St. Louis area. And the rabbi that was presenting knew her. And that's why he talked about this. And my mom was at the thing, and there was something that she said, maybe something like how there's an elfish look, like it looks like an elf. And my mom in the back of her head said, "Oh, that's so interesting." They said like Brady, one of her friends said he looked had an elfish look. And there was a couple little patterns, a couple little things, and I don't remember. There was one specific that kind of raised the red flag.
They had shown photos, and one was of the rash, and the other thing was Lauren's brother was getting married, and he had just done the screenings, and he came back as a carrier for Bloom syndrome,
which that was on the panel when
he did it.
So
by that
that's
time.
good.
So then my parents then called me and said, "Hey, have you ever, just out of curiosity, have you ever had Brady tested for Bloom syndrome?" And I actually hung up on my parents at that point because I was like, "You guys always are looking for diseases, like just stop." And I hung up. And then,
I'm sorry.
No, it's fine. But we had that conversation, and then we decided we weren't going to test Brady because it was ridiculous to give him more tests. All he does is take tests, So I was like, look, there's a 50% chance that I'm a carrier, right? We're just playing the numbers.
We'll give you the test.
Yeah. No, I was like, well, so that means meaningless. Let's test Melanie and see if she's a carrier. If she's a carrier, then we'll go somewhere. So she came back and Melanie was a carrier. So at that point, we kind of figured that maybe there was something there. So then we had Brady tested, and that's when he came back.
Yeah. Did you apologize to your parents?
What's that? Yeah. I apologize to my parents. They get a little, they're typical Jewish parents, right? They get a little answers. So it's okay. But yeah, no, that's kind of how our journey happened. And it just goes to show you, I always use this as an example when I'm talking about Bloom syndrome, is that, look, we're educated people. We have a genetics background, and we missed this diagnosis until he was 5 years old. It's unquestionable that there are more people that have Bloom syndrome. And in my position on the board, I'm always welcoming new people into our Facebook community. And we find people who are diagnosed at 15, 20, 25 years old.
Oh my goodness.
Oh, wow.
Who've never been diagnosed because they've never really
Nobody knows it.
No one knows.
They've
never had They've never had
To test
medical,
it. Yeah.
they've never had any problems. And if you look at the incidence in, of the mutation, there's more than three, they're just by numbers, by math, there has to be more than 300 diagnosed people, 300 cases. There's got to be a few thousand out there that we just aren't seeing because of testing and because of screening and because of diagnosis.
So
Wow.
just to bring our listeners along, so in order for this genetic symptom to show up in your child, both parents have to be carriers. So both of you were carriers, which produce Bloom syndrome. So now you've told us that your brother is also a carrier. So have their reproductive outlook changed? Has this changed how they're planning to proceed in the future?
No, they have
No.
two children, and my sister-in-law is not a carrier, so
Okay.
there's always a chance of a random mutation, right? Which
Sure.
that's
Mhm.
extremely rare. So versus two carriers, there's a 25%
Two
chance
carriers.
versus
Sure.
one carrier, one not. You're talking infinitesimally small.
Wow.
Okay.
Now, I must ask, do you do anything to reduce Brady's risk for developing cancer?
Of course, Bloom Syndrome Association has a set of medical guidelines
Okay.
that they've put out, and that's available on the website, and it was created by experts in the field. In fact, Brady's former dermatologist is one of those people that created the guidelines.
Oh.
So we follow those, and those at the age starting at 13 recommend colonoscopies every 12 to 18 months.
Oh my goodness.
Oh, wow.
Also starting at the age of 13, full body MRIs. Because of the genetic mutations, it's much easier if you find something to remove it than it is to have to deal with chemotherapy and radiation.
Oh,
So like any cancer patient, you want to catch this early.
Yes.
So
Correct.
the screening is done at a very young age because Brady is at high risk of developing cancer. And this would be cancer of any type from what you're saying. Is that correct?
Correct.
Okay.
and based on the light sensitivity and the DNA damaging chemicals, how does cancer treatment differ to account for this if it's something that, God forbid, someone with Bloom syndrome needs?
Right. So the light sensitivity is an interesting thing because that's something that we always bring up, and the mantra's always been sunscreen, 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 cover the kids, they can't go outside. But interestingly enough, the incidence of skin cancer has been remarkably low. So
Wow.
so that hasn't been, so we're actually kind of rethinking that, or medicine's rethinking that a little bit. But as far as treatment goes, that's really the next thing that we're looking at as a community, and the nice thing is we have an MSAB, a medical science advisory board for Bloom
good.
syndrome. So
Yeah.
that's something that we're looking at actively right now, is how to treat cancer patients, and now we're doing that with tissue collection, tissue specimen collection, and also through basically peer reporting. Right, this is what I did for this patient, because there's so few, there's not a thing. But what the literature really shows is really smaller amounts of dosage, whether it be radiation, chemotherapy, whatever it is, to not give that full dose, to give a smaller amount.
Okay.
And treat it as localized as possible. That seems to be
Yes.
without getting too technical, it seems to be the most beneficial. And to Melanie's point, the screening is really what comes into play, right? We know we're not going to prevent cancer. There's really no way to prevent it. And we know that likely that Brady at some point is going to have to deal with cancers. But if we can catch it early, and if we can catch it, before it spreads, before it becomes, too problematic, then it's much more treatable.
Yes. That makes
So
sense.
can I talk to you both as parents? You spend a lot of time with Brady at doctors. We have heard about all the testing that went in even before he was diagnosed, before he got the growth hormones. And now the testing that you're doing to prevent cancer, or at least to hunt it down at its earliest stage. While you're taking Brady to all these appointments, how do you make it fun?
I take him to most of his appointments, and I'm not sure it's ever fun to get poked and prodded and asked the same questions. But I mean, he is a real trooper. It's something he's been doing his entire life, because before we had a diagnosis, we were going to the doctors to try and find a
Yes.
diagnosis.
Yes.
And once we had a diagnosis and he knew why he was going to the doctors, it made it a lot easier for him.
Oh, wow. That's wonderful.
I mean, he takes his phone or he takes his iPad with him. And if he's getting blood work done, we have, for a while, it was for each vial of blood, you get a cake pop. But
That's great.
at
That's
some
great.
point,
That's great. How old is Brady now?
He's 14.
14.
And so his whole life has been spent with screenings and poking and prodding, to the point that is it almost at this point routine for him?
Yes.
Yeah, that's the thing. I mean, it is terrible and it sounds terrible, but when it's part of your daily routine, it's not. It's just part of your daily routine. It's part of who you are. He gets growth hormone shots 6 days a week. He has an infusion once a week. It's just part of who he is. He knows it and he accepts it, and it doesn't consume his life. He's not defined by Bloom syndrome, but it's just a part of who he is, and he deals with it and goes on with the rest of his day.
Is he? Yeah. Does he have hobbies? Does he do music or anything?
He's a gymnast. And he's actually talk about using something to your advantage. He uses his small size and his strength to his advantage. He's we can brag here a little bit. He's actually He's actually a national champ in 2 events last year.
Goodness.
And
really? Congratulations.
For his group. And he came in like 6th overall in his division. And he's a legitimate, really good gymnast. And again,
great.
it's something where size actually is to his advantage. So so we found something he found something that works. So he goes with it.
Oh, isn't that? Oh, that's so wonderful.
So if someone asked him,
That's fabulous.
to define himself.
Congratulations.
Oh, you're welcome. If someone asked him to define himself, he would not say he has Bloom syndrome in his first sentence. He would say he's a gymnast. Right.
And a gymnast and a
go.
game designer.
Supportive parents.
For sure.
Yeah.
A game designer, and what else, Melanie?
And he likes to play piano. He
Piano.
just recently started lessons. And I said to him, I was like, are we doing this to do piano recitals? Are we doing this because you want to be a great pianist? And he said, no, he finds it very relaxing. So
wow,
keep doing it.
Oh, that's
it's very
wonderful.
self-aware.
What a mature response. A very mature response.
Absolutely.
So now I have to ask you, you have 2 children, 2 sons. Your oldest, Noah, is at an important part in his life. He's getting ready to apply to colleges. And for those of us who have been through this time, it's difficult, especially, I hate to say it,
but it's
the
fun.
boys are not on top of it as much as the girls are. So you never know if they've filled out the forms. So it requires a bit of oversight. So I wanted to ask you, can you tell us how you juggle the demands of one child and demands of another?
Well, I don't think, I'm going to be really honest, I don't think we do it any differently than any parent who doesn't have a child with a rare genetic disease. We give them both as much time as we can, and they are very good to each other. We're really lucky, and that they actually like each other. So I don't think Noah's ever felt shortchanged or cheated because we've taken Brady to the doctor or because we've done other things that we have to do with Brady. I mean, we've gone to several Bloom syndrome conferences and Noah's gone with us, and there have been other siblings there. And when we were taking Brady to New York to the clinic, where the Bloom syndrome registry is housed for appointments, Noah went with us and we made a weekend out of it. And it was just, the doctor's appointment was an hour on our to-do list.
Wow.
Well, I think that's how you're doing it. That's exactly how you're doing it. You're managing this time, but you're creating a life, and it's not just focused on an illness, but focused on family time is what it sounds like.
Yes.
Well, I think that's a really great lesson because there's so many parents. We have interviewed a number of parents who have children who are struggling with a rare disease. And it's not, you make it sound easy. It's not.
It's not.
You all are really adept at what you're doing, and it's hard to balance and hard to give equal time and adequate time. Even if your children, the more children you have, it seems as though less time. So 2 is a pretty demanding schedule, and you both work and you're busy people. So I really commend you on how you're balancing both your children's lives and obviously a healthy, thriving marriage as well. I mean, I think all this family time is what it sounds like is the key to success in your family. Would that be correct?
Yeah, I would just add that we got the first conference that we ever went to. I got a great piece of advice from a father. His son has Bloom, and that said he never treated his child any different. You know, he treated it. He never got, like, you know, the son sometimes would try to get away with things, and we always tell this story in nursery school. Brady, we were there. It's at our synagogue, and all the kids were walking. It was like in the twos, and Brady was being carried by the teacher. And we're like, why is he being carried? She's like, oh, he said he can't walk. His legs are tired. I'm like, no. Put him down and make him walk. You know what I mean? Like, he's doing
Not
that.
what he said.
Yeah.
He's milking it.
Right?
Yeah.
He said, I can't walk that far. My legs are shorter than everybody else's.
Right. He said his legs are, that's what it was. His legs are shorter. And we were like, no. But he's
Very
milking it. Put him down.
argument.
Right. Well, he's always been a little, you know, but put him down and make him do it just like everyone else. And that's kind of been our attitude. It's like, yes, he has that. And sure, we have to do the doctor appointments, do the shots and the screenings. And he gets different things for that. But overall, we're not, it's hard, especially when he's smaller than everyone else. And he is a smaller, you know, and he's got that, you know, looks a little younger, but to treat him age appropriately and not, you know, size appropriately. And I think that is a really important advice, especially for Bloom syndrome individuals, but probably for any individual.
What great advice. What great advice that to not to focus on the syndrome, but focus on the child and the beauty of each of your children. I think that all of us can take this to heart. Before we wrap up, Melanie and Lorne, is there anything you would like to add? Any advice you would like to give to our listeners?
One thing that I will say is, I mean, Brady is 14 now. We didn't tell him when we first got the diagnosis. And I think we made the right decision when we told him. And we didn't make a big deal out of it. We had, again, from that first conference, I had a mom say to me, you know, when I told my son, we made a book about all of the things that he loves and all of the things that are part of him. And it was just one of the pages. So we didn't do a book.
I like that.
We did sit down and we talked about, at that time he was playing soccer and playing with friends and video games. And, you know, Bloom syndrome is simply a part of who you are.
One more
just like
item.
your eye color. It's really not doesn't define who you are. And the other thing that Lorne and I have made a conscious decision about is this is Brady's journey. And yes, we have needed support and we have needed family, and all of our friends and family have been unbelievable when we've asked for things and we've asked for time and to juggle with carpools and things like that. But it is Brady's journey, and we have made a conscious effort when we talk about it publicly that we make sure it's okay with him first. So before we agreed to come on your podcast, he and I sat down and had a conversation. And I said, this is what we're going to talk about. Is there anything else you want me to talk about? Is there anything you don't want me to talk about? Because I don't want him to turn around when he's 20 and say, oh, my parents put this out on social media and I'm not okay with it.
Yeah, we're very big on the social media aspect. I mean, the only time we ever post really anything about Bloom is really for Rare Disease Day or for, you know, for doing a big fundraising campaign. And again, that's with Brady's blessing, and he lets us go with it. You know, then look, for some families, you see individuals that have conditions and they're posting about their child all the time, and maybe that's okay with them. But for us, it was it was really important to us that Brady kind of set the tone and we let him make the decisions because it's his journey. So.
Boy, you have really given us so many tips on how to parent special children. I have to say, I mean, truly concrete tips on how to take care of all your children so that they all get the parenting that they need. What wonderful examples you are to our community, and I can't thank you enough for sharing your story with us. You've really been exemplary, and we have learned so much from you.
Absolutely.
We're thinking about you, and we will follow your journey, and for both boys. Thank you so much for being with us today.
Thank you. Wonderful, wonderful episode.
Thanks for having us.
Thank you for listening to this episode of It Happened to Me. We encourage you to learn more at ithappenedtomepod.com. Please use the contact form on our website to submit your guest suggestions, comments, questions, ideas, and feedback for the show. You can also email us directly at ithappenedtomepod@gmail.com. We would really appreciate it if you can leave us a 5-star rating and review on your podcast app like Apple or Spotify. This helps others in the rare disease and medical challenge community find us. It Happened to Me is created and hosted by Kathy Gillenhorn and Beth Glassman. I'm Keir Deneen from DNA Today, and I serve as our executive producer and marketing lead. Amanda Andrioli is our associate producer. Ashlyn Anokian is our graphic designer. And remember, it happened to me. I'm not alone, and neither are you.